Hey everybody, welcome back to the ECG lecture channel here. My name is Reed. We're going to jump into cardiac action potentials as an introduction to antiarrhythmics. And I thought there would be probably no better place to start than our cardiac action potential. And so this is the action potential diagram for our normal cardiac cells. And so what you'll notice here is that our x-axis is time, our y-axis is membrane potential. Membrane potential is defined really as the difference in positive charges that are inside and outside of the cell. And we have all these sodium, potassium, calcium channels, chloride channels that allow for our cells to live in this balance of positive and negative. And so we know that there is more positive outside of the cell and there's more negative inside of the cell, relatively speaking, in these cardiac cells at rest. And so this is seen, if we look at phase 4 here, this is when we are at our resting membrane potential. And notice this means that all of our cations and anions are set in balance so that we are beneath this dotted line, which is our threshold potential. So this cell, when it's in phase 4, is in a ready state to fire off. It is beneath our threshold potential, so that it is more negative than our threshold potential. And it is waiting to receive a stimulus from adjacent cells, because we know these cardiac cells will propagate that potential from cell to cell to cell. And so once it is in this phase 4 resting membrane potential, it is able to do that. You'll notice that phase 4 has a slight upslope, and it's not perfectly flat. And that's because each cardiac cell does have its own intrinsic ability to, act as a pacemaker cell of its own sort. And so if it doesn't receive a signal, at some point it will get above that threshold potential. And that's really accomplished in phase 4 by these channels. They're called the funny current channels, or really they're HCN channels that allow for maybe some sodium and some chloride and some potassium, to slowly seep into the cell so that if it doesn't receive a signal, it'll fire off, right? And that's kind of our concept of ventricular escape beats. So phase 4, we are completely repolarized to the point where we are beneath our threshold potential, waiting for a signal. Now, once we hit our threshold potential, we go into phase 0. And phase 0 is defined as sodium rushing into the cell. And so sodium is coming in to the cell, and that is rapidly making our action potential. You're going to see it stroke more positively because we're having more positive cells coming, or more positive ions coming into the cell. And so that is changing the membrane potential to become much more positive as sodium rushes into the cell. Now, as the membrane potential changes, all of these voltage-gated channels that are also sitting on the membrane are also going to start to adapt and change, and that's going to allow for the turning on of our cardiac cells. So phase 0 is that upstroke in the action potential, and that is defined as sodium rushing into the cell once we hit the threshold potential. Now, phase 1, what you'll notice is we get this downsloping in this action potential, and phase 1 is described as potassium coming out of the cell. So we start getting the opening of these potassium channels, and as positive goes outside of the cell, we know potassium is a major intracellular ion. As it exits the cell, it's going to decrease that membrane potential a little bit. So it's going to start pulling it down. And at almost just a little bit after that, we're going to be in phase 2, where you start to get now the activation of these voltage-gated calcium channels that allow for calcium to rush into the cell at the same time that those potassium ions are headed out. And this inward influx of positivity and outward efflux of positivity is going to cancel each other out. And so notice phase 2 is characterized by more of a flattening of the action potential. Now, during phase 2, this calcium that is coming into the cell the calcium is what activates myocardial contractility or contractions. And so this is phase 2, is when you see calcium is rushing in, it is binding to all of the different parts of those myocardial cells that allow for the activation of all the fibers that allow for the squeeze and contraction. And so as phase 2 continues, we will see that as calcium makes its way into the cell, and as potassium is rushing out, there's only so much calcium that's going to come in. And so phase 3 is defined mainly by exclusive potassium continuing to head out of the cell. And as positive ions are leaving the cell, it's going to become more and more negative, and we're going to be returning back to our resting membrane potential. And so as potassium is coming out, we would call this repolarization, because we are bringing the membrane potential back down to the point where we can now ideally go beneath the threshold potential. Remember, this is the threshold potential. We'll need to go beneath the threshold potential because in order for us to fire another beat or have another action potential, we must go below the threshold potential and reload. So we are right here, we are reloading because we are unable to initiate another action potential in between any of this time. This is our time that we are refractory, which really means that we are refractory to depolarizing again. We must reload in order to fire off an action potential. And so, as I said, this is repolarizing. You could say the opposite in our phase 0 here. This is depolarizing or depolarization. So phase 0 is our depolarization. This is the activation of the cell. And down here in phase 3 is our repolarization, where we are reloading the cell. And anywhere in between the initiation of depolarization and repolarization, that is the refractory period where the cell is unable to conduct another signal. That's what refractory stands for. And so that's our cardiac action potential. Why do we go over this first? Well, all of our antiarrhythmics are going to either affect sodium, potassium, calcium channels, and as well as others, but those are the ones that are mainly going to affect these channels. And so by understanding this graph and what contributes to each phase of this cycle, we'll better understand the changes to this cycle that are affected by antiarrhythmics. So continue to our next video where we're going to talk about pacemaker potentials, because this is a cardiac action potential of a cardiac myocyte. Pacemaker cells of the SA node and AV node are a little bit different in the way they function. So I'm going to briefly go over that here in the next video, and then we'll go from there. So hope everybody has a great day.